North.
Leading the way. How scientists in Sheffield are working on a brand new test for one of the most deadly forms of cancer. Now, imagine the agony of waiting to discover if you have cancer. Well, currently it can take days or even weeks for some results. But researchers in Sheffield are developing a new test for oral cancer, which could give the results within 20 minutes.
Now, they're working with researchers in Texas, and it's hoped within 5 years, high street dentists will be able to carry out the test. Oral cancer is often not detected early enough, and only 50% of sufferers survive. Here's our health correspondent, Penny Bustin.
It's Martin Thornhill's job to check out that the new is as accurate as the old.
This is Katie, our research nurse, and she's just going to take this small brush biopsy sample from inside the mouth for you.
Clinical trials of this new test will last 2 years. The first patients are being seen this week.
Okay, so I just want you to open wide.
The process is in stark contrast to the current method of checking out suspicious lesions, which involves a local anaesthetic, a scalpel to remove a sample, and off-site laboratory tests. Here, a small brush, softer than a toothbrush, is all the patient has to endure.
All it involves is removing a few cells from the lining of the mouth with a brush, and those are put onto a card, rather like a credit card, which is then put into a small machine like a desktop computer, and within about 8 minutes will produce a result which will say whether it's a cancer, some other benign lesion, or possibly a lesion that's not cancer yet but could progress to being cancer.
David Nicholson bears the scars of oral cancer. He had a growth and part of his jaw removed 2 years ago at the Charles Clifford Dental Hospital.
Little brush like this, finding the problems that you've got in the mouth, I think is absolutely fantastic. Certainly a damn sight easier than having to go through the ordinary biopsy of the injection, taking these samples, which is not the most comfortable of things to have to endure. So the use of something like this is absolutely wonderful.
Sheffield's role in this international trial is to recruit patients and cross-check their results while Texas refines the technology.
It's pretty unusual actually, particularly in my sort of field, to have an international collaborative project like this. I think this is a groundbreaking situation and hopefully will rapidly result in a new test that can be wheeled out to use with the general public and by dentists and doctors internationally.
If all goes well, the test should become available in doctors' or dentist surgeries within 5 years. Penny Bustin, BBC Look North, Sheffield.